No.
Okay, perfect. Also, the last thing I want to tell you about the grade. So don't trust the percentages in Canvas. It's not calculating the final percentage. You have to do that yourself if you want to know. Secondly, um, secondly, what I wanted to tell you is also that whenever there is an activity or a laboratory or something, even if the activity tells you that you have to upload it in group, I always ask you, it's a rule for my class, I want everybody to upload it individually, because it's always an issue that uh, certain students, they will tell other students that they uploaded it. So I want everybody to take the responsibility themselves. Whenever you do something in group, you should have that document yourself as well, and that's the second reason I want you to have all that material yourself. um, and that's why you have to upload it individually, even if the activity says that it's you can upload it in group. I want everybody to have everything in their Canvas. Okay, it's easier for me, it's easier for you. Okay, that being said, I mean, there's nothing new, you already knew that. That being said, we are going to start where we stayed with the digestive system. So last week we talked a little bit about the stomach, and now we're starting with the small intestine. The small intestine has three big parts, okay? The first part is called duodenum, the second part is called jejunum, and the third part is ileum, okay? Duodenum has its name because it's duodeo, which means 12 fingers, okay? And they call it duodenum because it's the length of more or less 12 fingers. It's a very important part of the small intestine because in that part, it's where all the accessory organs, which is pancreas, liver, and gallbladder, they release their secretions in this part of the small intestine. Okay. Then we have the second part, which is the jejunum, and then the third part, the ileum. It's about 6 meters long, and the small intestine does very, very important things. In fact, all the nutrients are absorbed mainly in the small intestine. What happens here is we have enzymatic enzymes. I mean, they're always enzymatic, and they will break down the nutrients in small pieces. And intestine is our small intestine is designed to absorb these nutrients in a special way. And how does that work? Is very interesting because then we have to look at the microscopical level how that really works. So let me share this with a sketchbook if you want. So you can already see that it's a little bit like this. You have the duodenum. I know. A ver. Se ha detenido. Ah, sorry, something happened. So if we have our small intestine, it's circular. I mean, it's not really circular, this, but if I would take one piece out of it and I would make it bigger, you would see that it's like all folded like this, okay? It's a membrane which is all folded like that, okay? If I take another piece out of this and I would make it bigger, you would even see that it's even more folded, okay? And that's because all this small intestine has specialized epithelial cells, which you can see, like you can see here in the microscope, and it's fully lined with villi, and those villi has cells, and those cells, they're very specialized to absorb all the nutrients. So all the nutrients from all the food you eat, they are absorbed through the cells of the lining of your small intestine. And then you can see here that it absorbs through the cells, and then it's released in the blood. Okay, that's basically what happens. It's very important because you need all those nutrients for all the organs in your body. Here's a little bit the same thing. You can see what I just drew. Okay, so if you zoom in, you zoom more in, and you zoom more in, you see how specialized those cells are. And they are organized in such a way so that the small intestine has an enormous surface. It's very, very, very large surface in order to be able to do that absorption of all those nutrients. What can happen in the small intestine? One of the most common problems is, I know not most common, but one problem that is quite serious that can happen is the duodenal ulcer. This happens when the acid from the stomach leaks into the duodenum. And this can cause a problem which is very, very similar as the gastric ulcer, like you can see here. It's basically the acid that burns a hole in the lining of the duodenum. It can even perforate it. Very painful. The condition is very similar as the stomach ulcer. Okay, it's equally painful. And this is especially because when you have too much acid production and the sphincter doesn't cannot keep it in the stomach, it can leak into the duodenum and you have this kind of problems. Then the next illness is the gastroenteritis, or also called stomach flu, which is a little bit confusing because, in fact, it's not stomach flu because it's more happening in the small intestine. And this is something that you all had several times in your life. It is caused by bacteria or by virus or by parasites, amoeba or other parasites. And basically, it's an infection inside your small intestine. This typically causes diarrhea, vomiting, a lot of pain, cramps, even headache. Because if you have a lot of diarrhea, a lot of water is removed from your body, and it can cause a headache as a consequence. It also goes with the cramps, the fever, all of this. I think we all had this several times in our life, right?
I
This one,
remember like when I was like
yeah.
child, I think I had it like only like one time, and like my mom of something like she put something into the water, and I needed to drink it that, but it was like time years ago, maybe like when I was 4 or 5 years old.
Hmm. Well,
But recently I haven't had any
uh, that
stomach flu or something like that.
That's good, Gael, because this happens a lot when you travel or even when you change food that you're not used to. And in fact, for us, it might seem like it's a little bit annoying to have gastroenteritis, but in fact, it's still a problem which causes a lot of people to die in, especially in the third world. Even in Mexico, in Africa, in other poor countries in Latin America, in Asia, in India. So there's still a lot of people that die because of this kind of gastrointestinal illnesses, just caused by bacteria or by the fact that they don't have access to healthcare. And children die because of diarrhea, because of dehydration, because of malnutrition, usually linked to gastroenteritis. And do you know what the real big problem is? It's not really the food, because if you cook the food properly, usually you're fine. That's why cooking is a good idea for the food, because it kills bacteria, and it's safer for us, and it's easier to digest. Basically, gastroenteritis is not caused that often also a lot by food, but even more often by contaminated water. And I don't know if you know the numbers, but there is more than 1 or 1.5 billion people in the world who have no access to clean drinking water. And this kind of infection, which we call fecal-oral infection, fecal comes from feces, which is like basically animal and human excrement that gets somehow into the water, and the people, they drink the water, and it's full of bacteria, making you ill, and the cycle is complete, of course. So that's one of the main causes. It also other illnesses are related to the same fact of not having safe access to clean water. Okay, the next part is the large intestine or colon. Okay, this colon has three big parts, It's the colon itself, or the rectum where we store the feces before defecation, and the anus, which is basically a sphincter, a circular muscle which opens and closes whenever you want to defecate. The colon itself, the large intestine, has three parts. In fact, four if you take into account the appendix. So it's the appendix, the ascending colon, the transverse colon, and the descending colon. It's because this one goes up, this is transversal, and this is descending. If you would look at yourself, it looks a little bit like this in your belly, you know, like it goes like this more or less, and then it's connected to your rectum and to your anus. This this colon is not doing so much work anymore. In fact, the big work of absorption is done by the small intestine. It's absorbing all the nutrients. However, the colon or the large intestine also does some work still. It mainly absorbs water, minerals, and salts and ions. Okay, okay, but it does not absorb that many nutrients anymore. So it really forms the feces, it makes it drier, it removes the water from it. And in the rectum, there you accumulate those feces, and then the anus is relaxed in order to remove those feces um, from the body. Okay. So also again, it's all the time the same thing, you know. In every part of the digestive system can get infected, and when it gets infected, it indicates that there is some kind of inflammation. And when you have this in the colon, we call that colitis. This can be caused by bacteria, usually bacteria, could also be viruses, could also be bad food. Okay, I mean unhealthy foods can also cause chronic colitis. So I don't know if you know that, but do you know where your farts come from?
The cases of uh, how do you say, the decomposition of food.
Yes, but what is producing the gases in your colon and your small intestine as well?
Bacteria.
Yeah, exactly. So some people they think that you have farts because you eat too fast or you swallow air. It's not true. Your whole colon is full of bacteria, and those bacteria they produce gases whenever they help with the digestion of food. And those gases, depending on what you eat, they are released. We all know that because if you say you never did any fart in your life, I don't believe you. We all do that, but you all also know that depending what you eat, you could be more farty or less farty, you know. So basically those gases are produced by the bacteria in your colon, and in a normal situation you have healthy bacteria in your colon. Okay, those healthy bacteria they help with the digestion of many things, but it's also possible that in the colon, because of bad food or contaminated food, those bacteria, the good bacteria are replaced by bad bacteria, and they can produce different kind of gases and they can make you ill. um, that's why it's so popular lately to drink probiotica and Yakult, these kind of things, because these products they claim, yogurt as well, these products they claim that they restore your intestinal flora. And when they talk about intestinal flora, in fact, they're talking about the bacteria in your colon. And don't think it's something weird that you have bacteria in your colon. You should have bacteria in your colon. That's a good thing because, in fact, like I said, these are good bacteria, and those good bacteria they are competitive with bad bacteria, and they avoid that you get ill. Okay, so it's very smart, in fact, of our human body and of evolution that we have bacteria in our colon. In fact, healthy, good bacteria. We live in symbiosis with them, and in fact they protect us from bad bacteria. And whenever you get ill, you have diarrhea, you produce very dirty gases, then it's possible that those healthy bacteria they lost the battle against the bad bacteria, and then you get ill. So according to this idea, there is also people that believe, and it seems to be working according to the medical literature, is that you could do like a bacterial transplant. And how does that work? is that you take a healthy person with healthy excrement or healthy feces, you will dilute that feces in water and you will inject that into the anus in order to restore the intestinal flora of a person. I I know it sounds weird, but there is it's a therapy that is being used, okay, and it seems to be successful, okay, because there's people that are have so bad bacteria in their colon that even with the strongest antibiotics they cannot get rid of it completely, and it seems to be that restoring this bacteria flora in the colon can be fixed by taking a feces transplant, a bacterial transplant. Okay, the next thing is another problem of our colon, in fact, of the exit. If you don't want to see it, don't look at it. It's a confronting picture. It's called, it's hemorrhoids. And hemorrhoids is a problem because all of us, or many of us, will be confronted with it sooner or later. There's two types of it, internal ones and external ones. And what are hemorrhoids? Well, it's basically swollen veins in the region of the anus. Okay, it even is the rectum that because of gravity comes a little bit pushing against the anus and can come out a little bit. Okay, what are the causes of hemorrhoids? There are many. Okay, hemorrhoids can be caused by it's definitely every time the same story in the digestive system. They can be caused by what you eat. We know that alcohol, a lot of meat is not very good for you. You have to make sure you have enough fiber. Has also to do with drug consumption, alcohol consumption as well. It seems to be there is a genetic factor involved and also a professional factor, because it seems that people who have a job which involves standing up for a long period of time, they're more prone of developing these hemorrhoids. Also, pregnant women, they often get hemorrhoids because of the pressure in the abdominal cavity, and they stop having contraction, strong contraction in the anus. That's another problem. So that's the thing that is a little bit related with drugs. In fact, your anus always has to be well closed and has to be under enough tension in order to avoid hemorrhoids. So if you're really, really tired, if you stand up a long time and your anus is losing muscle power, let's say, then there is more risk that those hemorrhoids are formed, because the veins, because of the gravity, they start accumulating blood, they become more and more swollen, and as a consequence you have hemorrhoids, which can be very, very painful. In worst case scenario, you have to remove them with surgery. And yeah, it's very painful indeed, hemorrhoids. So you don't wish this for anybody. Okay, and it's very common. You can have very big ones, you can have smaller ones. If you have a smaller one, it's not that botherful. With some cream you can get rid of it, but it's really bad, then you have to remove them with an operation. So the other thing is appendicitis. I have to mention it because it's something that is very common as well. Appendicitis is something that is a small thing that is next to our ascending column, and we don't really know what the function is. Okay, there is a lot of debate about we think it's a remnant of evolution that doesn't really have a function anymore, and it seems to be that it gets infected easily if you bite your nails, if you eat a lot of seeds, and those things that don't digest well, they get stuck in that area, and then easily the appendix can be infected. And it can be very serious, because if it ruptures and you get this bacteria in your abdominal cavity, you can do an anaphylactic shock, which could be lethal. So there are people that have died of appendicitis because they couldn't have medical help in time, and they died. So nowadays, if you want to go to Antarctica or something, they ask you to preventively remove your appendix in order that this cannot happen. Because imagine you're in Antarctica, you're a researcher, and you're on that continent, and all of a sudden, it can go really fast. Appendix problem, you could feel perfect in the morning, and in the afternoon, you could be in the hospital. It goes that fast. Okay. So of course that's dangerous. So those people, they have to remove the appendix preventively in order not for this not to happen in a place where there's no access to medical healthcare. It also seems that it doesn't really have any proper function anymore nowadays. We can live perfectly without it, without any serious consequences. So, guys, a little word about colon cancer. Again, a cancer of the digestive system. The prognosis is poor. If you have colon cancer, you have everything to worry about. It's really, really bad. It spreads very fast because there are so many veins that go through that area, and it can spread very, very easily. Okay, so colon cancer is very, very serious. What are the causes? Against red meat, fast food, bad diet, a lot of alcohol. I mean, it's always the same, you know. You have to eat enough fiber. The fiber helps to mix the fiber itself. You don't need it because fiber is something that our body cannot digest. However, it's really important to push everything through the digestive system. If we don't eat fiber, then certain things like red meat and other aggressive nutrients, they are too much in contact with our intestines. And if they're too much in contact with our intestine, they can react badly to the cells. And whenever those cells they convert into malignant cells, then a cancer might occur. So that's why fiber is really, really important, that no food stays too much in our intestine, that it's like a steady flow of the food passing through our body, comes in, comes out. And that's why vegetables are very important, because it's the vegetables who has the fiber. Okay, if you eat only red meat, you will typically see that your poo is very dense, it's very sticky, it's very smelly because of the lack of fiber. Okay, so really only meat eating for us is very, very unhealthy, and it's the perfect ingredient to have certain cancers in your digestive system. By the way, that's another thing. If you start bleeding out of your anus, if it's a hemorrhoid, you're fine, you're lucky, or it's like a small crack or something in your anus, which is a small capillary broken or something. There's not a big problem if it's a little bit of blood. But if you have several days, I mean, don't panic if you have one day a little bit of blood. It could be a small hemorrhoid or something, no big deal. But if you have several days or even weeks that you always see blood in your feces, you have something to worry about, and you should immediately go to a doctor, because that means that something is leaking in your intestine, something is bleeding on the inside, and that's never good. So it's always a good idea to have a look at what you dropped in the toilet. Okay. Yeah, it sounds a little bit disgusting possibly, but you have to check on yourself, you know, and by looking at your pee and by looking at your poo, you have immediate indications of how your health is doing. And in fact, if you go to the bathroom and you defecate, in fact it should be like a strong solid turd. Okay, it should not be sticky, you should not use too much paper. If it's extremely smelly, if it's extremely sticky, if it's really, really dark, all of that are really indications that you have not been eating properly. A normal poposina, to say it like that, it should be more or less dry, it should be very clean. You should not wipe half a roll of toilet paper to clean it, because normally, naturally, if you eat enough fiber and vegetables, your poo should smell. It always smells, of course, but it should not smell really bad. It should be clean, and it should not be sticky. Okay, so if it's really dark, if it's sticky and it smells, then change your diet seriously. Okay, this brings us to the accessory organs. We have liver, gallbladder, and pancreas. Okay, these are the organs that produce enzymes, and those enzymes, like I told you, they are released in the duodenum. Okay, so let's have a look at each one of them. One of the most important ones is the liver, because the liver is a huge sponge. It detoxifies all the blood so all the blood absorbs the nutrients from the small intestine. This blood immediately is sent to the liver to detoxify, and that's very good, because in fact the liver is in fact a big sponge to clean up all all the toxins in our blood before sending it to the vital organs like brain, lungs, and heart. We don't want toxins or bad things in the blood. So that's why we have the liver immediately filtering the blood that absorbed all the nutrients. Then inside the liver, there is a small organ, a little bit hidden, which we call the gallbladder. This gallbladder is producing bile. Bile is, in fact, a substance that helps us digest fats. Okay. Um, and then the other organ we have is the pancreas, which has both exocrine and endocrine function. Endocrine means hormonal function. You know that our pancreas produces insulin in order to be able to get glucose in our blood and our to absorb glucose. And the exocrine function of the pancreas is that it also produces enzymes like trypsin and chymotrypsin to um, to help with digestion of saccharides, fats, and proteins. Okay, so that's what I just told you. So, fun facts about the liver. The liver is a really, really big organ. It's about 1.6 kilos and it's the largest organ, internal organ. Okay, the skin is larger, but the liver is the largest internal one. It has about 500 different functions. So it does a lot of things. We will not go over all the functions specifically. An interesting fact is that if you would cut a piece from your liver, then it would grow back. It's the only organ in our body that does that, with the big exception of cirrhosis, which we will see in a moment. So our liver is a organ that which can regenerate perfectly, with the big exception of cirrhosis. Okay. Um, and then it filters about 720 liters of blood a day. So it's a lot. So this is a little bit of functions about those organs. We have seen that. I want to talk now about cirrhosis, because cirrhosis is something very, very serious. And a normal liver looks smooth, like you see on the drawing on top. And the liver with cirrhosis, like you can see here on the bottom, it seems to have like all kind of spots on it. Okay. And what happens, in fact, is those spots is scar tissue. It's damaged cells. And unfortunately, whenever the liver has cirrhosis, it cannot regenerate itself again. Okay. Is that, think about scars on your skin. You know that they become more rigid, it becomes more thick, and it doesn't do the original function anymore. This is the same thing for the liver. How do you get cirrhosis? Well, you get it because of certain viruses like hepatitis A, B, and C. But you can also get it from bacteria. If you have very strong chronic bacterial infections, it's possible that it also causes some level of cirrhosis. Definitely, you can get it from alcohol and from taking too much drugs or medicines, because that's really bad for your liver. And like I said, the sad story about cirrhosis is that there is no way back. The next picture is a patient with cirrhosis. And whenever you look in the future in somebody's eyes, when you see that the white of the eye is slightly yellow, it means that that person has a problem with the liver. The liver is detoxifying the blood. So whenever there is toxins accumulating, you will see that in the white of the eye, like in this man, you see how it becomes yellow. In fact, it's not only the eyes that become yellow, the toxins will be accumulated everywhere in the body, but you only see that in the eyes because it's the only part that is white. Whenever the eyes, the white of the eye becomes starting yellow, this person is seriously ill. This person has to go to the hospital. So whenever you see that, this person has probably severe cirrhosis already and needs a liver transplant in order to be saved. What you also see very often with people with severe cirrhosis is that the belly swells a lot, like in this man. And why is that? It's because, like I said, the liver is a sponge. It filters the blood. But whenever the sponge is not filtering anymore as it should, instead of letting it pass, it will retain the liquids, because the liquids, they cannot pass anymore. And then typically you get a swollen belly. And there's a documentary about binge drinking, about young people in the UK who party a lot, and they drink like a whole bottle of whiskey and a bottle of tequila and all of that. And then there was one girl who also started to see her belly swelling. And because these people, they do binge drinking until they're in a coma, and this is this party culture and stuff. Of course, there's also a lot of unprotected sex in these subcultures. So this person was thinking that she was pregnant, but in fact, the news was worse than that, because she needed a liver transplant and otherwise she would die. And then, of course, you have the ethical questions, you know? I mean, you go binge drinking and you go partying and you do drugs and everything you want. Do you have the right to have a liver transplant when you live in such unhealthy conditions? You know, I mean, I believe that if you're so radical, then other people who lived a healthy life, they should be prioritized to have a liver transplant if they got sick because of a genetic situation, or they got infected with some kind of virus that is causing cirrhosis. Um, so take that into account. If you get a liver transplant, you take the possibility away from somebody else to have it. Okay. So take that into account, guys. I know that you're still, I mean, now it's not a lot of partying going on, but one day you will. And I'm not saying you cannot drink and you cannot party. I think you should. It's nice moments in your life. You should enjoy it. But like I said in the other group as well, if you go to a party is not twice as fun if you drink 8 beers instead of 4 beers, to give an example. My point being, there is no point in drinking as much as you can. There is no point in being drunk. There is no point in feeling sick. Whenever you go to party and you decide to consume alcohol, do it very responsibility. Know your limits. Never exaggerate, because you do irreversible harm to your body. And I'm not saying that I recommend you to drink and to party, but I know that most of you will. And I think it's okay. There's nothing wrong with it. But whenever you do it, then take into account that you have only one body and you can only be happy if you're healthy. And whenever you start destroying your health, then all the rest goes down with it. And the problem with alcohol especially is that people start at a young age and they think they're okay and they think they're fine and it will not happen to them. But this cirrhosis, cancer, colon cancer, all kind of diseases, they don't come knocking on the door, guys. It's not that they knock and you say, okay, come in or don't come in. No, all of a sudden they are there without announcing anything. Everybody who got that disease in their life, it came by surprise. So don't think it cannot happen to us, because it can. And the only thing you can do to avoid it is try to eat as healthy as possible and not drink too much alcohol. And even if you do all of that, it can still happen, but of course the possibility is way lower. So I really recommend you all to take care of your bodies, because it's more fragile than you think, guys. Seriously. Okay, gallbladder and pancreas. We have the gallbladder, which is producing bile. Bile is like a very special substance which breaks down fats into smaller pieces. Okay, whenever you eat too much fat, guys, especially when you eat too much fat, you can get gallstones. We call them pigment stones or cholesterol stones or gallstones. Okay, it can be due to your genes, to your weight, but it has all to do with your diet. If you eat a lot of fried food, a lot of fat, you upset your body. In fact, what your body will do, it will respond. It will say, okay, there is so much fat coming in, I will produce more bile, and it will overproduce so much bile, and then you can have the form. It will combine with salt, and it crystallizes, and you can get gallstones. So basically, you always have to keep everything in balance, because those gallstones, they're very painful, and if you have them, you have to remove them with an operation. And it's very often, I mean, there's a genetic factor involved, I'm not saying not, but it's very often it's the diet. Okay, all of these problems occur when you don't eat healthy. And then another illness, which is pancreatic cancer. Okay, what are the causes? Diabetes, smoking, unhealthy diet, again, drinking, genetic factors, chronic pancreatitis, which is a chronic infection of the pancreas. And the problem here is they don't really know what is the true origin of that. But the very nasty thing about pancreas cancer is that if you look to the prognosis, it has a 5-year survival rate of 16%. This means if 100 people get pancreas cancer, then after 5 years of those 100 people, there is only 16 people still alive. And those 16 people, they also don't have 20 years left. So it's a very, very deadly disease. And I think you all know this guy here in the middle, Steve Jobs. He died of exactly that. Amongst these other famous people that I don't know, it's a judge, and I don't know who is this, but they all died of pancreas cancer, which is really, really a horrible disease, because you could be fine today, tomorrow they give you the diagnosis, and in 6 months you can be dead. It's really that fast sometimes. It's a horrible thing, this. Then the last thing is our digestive enzymes, guys. You have to know the enzymes that are produced in each part. An enzyme is a molecule that helps to break down molecules into smaller molecules. In the mouth, we have said it was amylase. It breaks down starch into glucose or disaccharides. In the stomach, we had pepsin, which breaks down proteins. And then in the small intestine, we have trypsin, lipase, which is trypsin does proteins, amylase, you already know that, and lipase breaks down fats. And then in the small intestine, you also have some other enzymes, maltase, sucrase, lactase, which break down sugars, and peptidase, which also breaks down peptides. Okay, so you have to know a little bit those enzymes. So that's it. That's everything of the digestive system. I'm happy I could finish. I don't know if there are any questions about this. If not, we will tomorrow start with a little bit more simple respiratory system. I mean, it's not super simple, but it's less long than the digestive system because it has less parts and stuff. Is there any questions about this digestive system?
No.
No?
I
Okay.
have a question actually.
Yeah, go ahead.
The appendicitis, because I'm taking notes. What type of pain does it cause? Like cramps or
Uh,
bleeding?
which illness, dear?
It's appendicitis.
Appendicitis. It's a typical, I had it in fact, but I got cured. I didn't get operated, but I remember I was young. I was like 14 or something, and I got appendicitis. And it's basically I mean, I'm going to lower my screen. You cannot see it. You can see it. A bit. Maybe I remove my font quickly. Mhm. So if you look at my torso like this, the appendix is more or less here. Okay, so typically you get a very painful feeling in this side of the belly, right here. Okay, if it's in this area, it's typically appendicitis. On the other hand, sometimes people, because the nerves, they go everywhere, you can have referred pain as well. So sometimes you feel it a little bit more up or a little bit more down because the nerves go everywhere. But appendicitis is a very local pain in this area of the abdominal cavity where the appendix is located. Very often, if you have appendicitis, nowadays I heard they opt very easy to remove the appendicitis, remove the appendix. In my case, I just got antibiotics and I was better in several days, and it was okay because it was not so severe. But I remember it was really painful, and it's this stingy feeling in that area of the belly, and it generates very often fever as well. You don't feel really well when you have it. You get cramps, and it's a stingy feeling. It's like somebody's pinching you from the inside to the outside of your belly.
Oh, that's bad. Okay, thank you.
Anything else? Okay, if there are no more questions, we see each other tomorrow for the respiratory system. Have a nice afternoon, and yeah, take care.
Thank you, teacher.
Thank you.
You're
Thank you,
welcome.
Bye.
Bye.
teacher.